Hello dear students, today we'll discuss about the gross anatomy of uterus. Uterus is shaped like an inverted pear and it is a hollow muscular organ which is thick-walled. It is located in the lesser pelvis and it is obliquely arranged between the urinary bladder in front and below and rectum and sigmoid colon above and behind. On each side, it receives the opening of uterine tube at the superlateral angle, which is also known as cornu, and it communicates below with the vagina through the external os of the cervix. Now we'll have a look at the position of uterus in the gross specimen. Now this is the pubic symphysis and this is sacrum and coccyx. You can see the urinary bladder here. Then you have the rectum and anal canal here. Now this is the body of uterus. This is the cervix and this much part is the vagina. I hope you have got a clear idea about the position of the uterus in the lesser pelvis. Now we'll see the subdivisions of uterus. Here you can see the opening of the two uterine tubes. If you imagine a horizontal line connecting the opening of two uterine tubes, the part above the horizontal line, that is the expanded part above, is known as fundus. The part that is below is known as body, and the body extends up to a construction that is known as the isthmus, and this isthmus corresponds to internal os of the cervical canal. So the body extends from the fundus to the isthmus. Rest is known as the cervix. So the three subdivisions are fundus, body and cervix. Now on the lateral margins you have a broad ligament and also it is related to uterine artery. Whereas you have got two surfaces, that is anterior surface and posterior surface. Anterior surface is a surface that faces the urinary bladder. So it is also known as the vesical surface. Whereas posterior surface is one that is facing the intestine, so it is also known as intestinal surface. And this angle is known as supralateral angle or cornu. And this angle is very important because it marks the tubo-uterine junction, that is the junction where the uterine tubes are opening into the uterus. And also it is related to two ligaments, that is the round ligament of uterus and ligament of ovary. Now the third part, that is the cervix, extends from the isthmus, which is corresponding to the internal os of cervical canal and external os. So this cervix ends at the external os, which opens into the vagina by perforating its anterior wall. And the cervix is further divided into supravaginal part and vaginal part. Now we'll have a look at the gross specimen. So I think you can identify the fundus here. This is a cut section and it is cut open. The uterine cavity is open. Now this is the fundus and this is the body and this region is the cervix. Now next we will see the uterine cavity. The uterine cavity is divisible into two parts, that is the cavity of the body and the cavity of the cervix, which is also known as the cervical canal. The shape of the uterine cavity is that of an isosceles triangle, whereas the shape of the cervical canal is that of a spindle-shaped structure. Now the cervical canal communicates with the cavity of the body through the internal os and it communicates with the vagina through the external os. So the cervical canal lies between the internal os and the external os. It measures about 7.5 cm in length. That means the fundus and the body together are 5 cm long, whereas the cervix is 2.5 cm long. The breadth is 5 cm. Thickness is 2.5 cm and the weight is 30 to 40 grams. The body is 2 times longer than the cervix in the adults, whereas the cervix is twice as long as the body in children. So now we'll see the position of uterus. What do you mean by the normal position of uterus? So when the bladder is empty, the position of uterus is said to be anteverted and anteflexed. That means the body of the uterus is tilted forward onto the superior surface of the bladder, which provides support to the uterus. Now what do you mean by anteversion? Anteversion is the angulation between the long axis of the cervix and the long axis of the vagina. So you can see the anteversion here, and this is about 90 degree. So because of this angulation, the uterus is bent forward, and when the bladder is fully distended, the uterus lies in the same axis as that of the vagina, and then the uterus is said to be retroverted. So retroverted uterus is a normal condition when the bladder is distended. Anteflexion is the angulation between the long axis of body of uterus and that of the cervix, and it is about 120 to 170 degree. And because of this angulation, the uterus is bent downward. So you have to remember the normal position of uterus is said to be anteversion and anteflexion, and anteversion is about 90 degree and anteflexion is 120 to 170 degree. So this image will give you an idea about the anteversion of uterus, that is between the long axis of the cervix and the long axis of the vagina. So you get 90 degrees here. Maintenance of anteversion is an important prerequisite for the support of uterus, and this is maintained by mainly three factors, that is the forward pull on the uterine fundus by the traction of round ligaments of uterus. Second factor is backward pull on the cervix by the traction of uterosacral ligaments, and the third point is the intrinsic growth of uterine musculature. So these three factors help to maintain the anteversion of uterus. Now we'll see the abnormal positions of uterus. So what are the abnormal positions that you know? That is retroverted uterus and retroflexed uterus. You know that the normal position is anteverted and anteflexed. What is retroverted? It means the body of uterus bends backwards in the rectouterine pouch. Instead of bending forwards, it is bending backwards. Now I have already mentioned that a retroverted uterus is normal if the bladder is distended. But if it is not distended and if the retroverted uterus is there, that means it is not normal, and it can predispose to prolapse of uterus. Now what is retroflexed uterus? Retroflexed uterus means the angulation between the uterus and cervix is not there. That means the uterus bends backwards onto the cervix, causing narrowing of the cervical canal, and it reduces the chances of conception. So these are the two abnormal positions, and retroverted uterus can predispose to prolapse of uterus, whereas retroflexed uterus can reduce the chance of conception. Now we'll see the various peritoneal relations of uterus. So uterus is an intraperitoneal organ. That means anteriorly and posteriorly it is covered by peritoneum, but the level of reflection is different on the anterior and the posterior surface. The uterus is held from the lateral pelvic wall by a flat sheet of peritoneum on either side, and that is known as broad ligament. Anteriorly, the peritoneum covers the anterior surface of the uterus, that is the body of uterus, up to the level of isthmus, from where it is reflected onto the superior surface of bladder, forming a small pouch known as uterovesical pouch of peritoneum. That is the anterior relation. Whereas posteriorly, it covers the entire posterior surface of the body and cervix of the uterus, and then goes down to cover the posterior fornix of vagina, and then gets reflected upon the anterior surface of the rectum. So now this pouch that is formed is known as the rectouterine pouch of Douglas, or you can say pouch of Douglas itself. This pouch is very important because it is the most dependent part, and this can be approached surgically through the posterior fornix of vagina for aspiration of any accumulated fluid. So I hope you can identify the pubic symphysis, then the sacrum and coccyx. Now this is the bladder, and this is the rectum and anal canal, and this is the uterus. So this region, this pouch is known as the vesicouterine pouch, that is between the bladder and the uterus, or you can say uterovesical pouch or vesicouterine pouch. And this region is, or this pouch is known as a rectouterine pouch, that is between the uterus and the rectum. The rectouterine pouch, or the pouch of Douglas. So what are the ligaments of uterus? So the ligaments are divided into true ligaments and false ligaments. True ligaments are nothing but fibromuscular bands whereas false ligaments are peritoneal folds. These fibromuscular bands are 8 in number, whereas the peritoneal folds or the false ligaments are 6 in number. So we will see the true ligaments. So they are a pair of round ligaments of uterus, a pair of McEnroe's ligaments, a pair of uterosacral ligaments, a pair of pubocervical ligaments. Now peritoneal folds or the false ligaments are uterovesical fold, rectovaginal fold, a pair of rectouterine folds, and a pair of broad ligaments. Now we'll have a look at 3 pairs of true ligaments with the help of this diagram. So identify the urinary bladder, the cervix and the rectum. You can see the pubocervical ligament, McEnroe's ligament and uterosacral ligament. The pubocervical ligament extends from the cervix to the pubic bone along the infralateral surface of the bladder. Whereas the uterosacral ligament is going backward, that means it extends from the cervix to the third sacral vertebra and it passes on either side of the rectum. Next is the McEnroe's ligament, which is also known as the transverse cervical ligament, and you can see here it is a fan-shaped fibromuscular band and it is derived from the condensation of the parametric tissue. It extends from the cervical-vaginal junction to the fascia covering the levator ani. You can also see that the ligament is related above with the crossing of the ureter and the uterine artery. And since this ligament keeps the cervix in position, it prevents the displacement of the uterus through the vagina. McEnroe's ligament is also known as cardinal ligament. So the other terms for the McEnroe's ligament are transverse cervical ligament and cardinal ligament. And because of this function, the tightening of McEnroe's ligament is done in surgical repair of the prolapse of uterus. Round ligament of uterus is also known as ligamentum teres uteri, and you already know that this is a true ligament and it is about 10 to 12 centimeter long. It extends from the lateral angle of uterus up to the labium majus. So after rising from the lateral angle of uterus, it passes laterally through the broad ligament. It crosses all the structures of the lateral pelvic wall, enters the deep inguinal ring after winding around the lateral side of inferior epigastric artery, and then passes through the inguinal canal and splits into numerous fibrous septa which are attached to the subcutaneous tissue of the labium majus. You already know the function. You know that it helps to pull the fundus of the uterus forward so that it maintains the anteversion and anteflexion of the uterus. And developmentally, it is considered to be a remnant of the distal part of gubernaculum of ovary. You can see here the round ligament as well as the uterosacral ligament, which helps to maintain the anteversion and anteflexion of uterus. The broad ligament of uterus is a false ligament. It is, you can see as the name suggests, it is a broad fold of peritoneum and it has got 2 layers. And it extends from the lateral border of the uterus to the lateral pelvic wall. So the uterus along with the broad ligament on either side divide the pelvic cavity into an anterior compartment and a posterior compartment. So in the anterior compartment you have got bladder, whereas in the posterior compartment you have the sigmoid colon and the rectum. So from the figure you can understand that the broad ligament is a quadrilateral structure. That means it has got 4 borders and 2 surfaces. The surfaces are antero-inferior surface and postero-superior surface, whereas the borders are medial border, lateral border, upper border and lower border. The anterior-inferior surface, as we have already said, since the anterior compartment, since the uterus is related to the bladder anteriorly, the anterior-inferior surface is said to be related to the upper surface of bladder as well as the paravesical fossa. Whereas the postero-superior surface gives attachment to the ovary by a fold known as mesovarium. So in this figure you are seeing the postero-superior surface. And the upper border is free where both layers are continuous with each other. And in the upper border, the medial 3/4 contains the uterine tube, whereas the lateral 1/4 contains the suspensory ligament of ovary. Now, the lower border is also known as the base of the broad ligament. It is attached to the pelvic floor, and here both the layers diverge. And the ureter passes below the lower border and the uterine artery enters the broad ligament through this region after crossing above and in front of the ureter. Middle border is attached along the lateral border of the uterus and it is related to the tortuous uterine vessels, whereas the lateral border is attached vertically to the lateral pelvic wall. Now we'll see the subdivisions of broad ligament. So they are divided into mesosalpinx, mesometrium, mesovarium and suspensory ligament of ovary. So mesosalpinx intervenes between the uterine tube and the ovary with the ligament of ovary. And this mesosalpinx contains the uterine tube, the anastomosis of the uterine and ovarian vessels, the tubules and duct of epiphron and tubules of parophron. Whereas mesometrium, it extends from the ovary and its ligament to the base of broad ligament, that is to the lower border. So it is the widest subdivision and it contains the tortuous uterine blood vessels. Whereas the mesovarium is derived from the posterior layer of broad ligament and it acts as a hilum of ovary and transmits the ovarian vessels. Now the fourth one is suspensory ligament of ovary, or you can say infundibulopelvic ligament. So it suspends the ovary. So that means it connects the ovary and the uterine tube to the pelvic brim and it transmits the ovarian vessels and nerves. Now what are the contents of broad ligament? So you know that the uterine tube is a part of the broad ligament and it is the uterine tube except the intramural part forms a content of the broad ligament. Then you have the proximal part of round ligament of uterus that is seen below and in front of the tube, and the ligament of ovary that is seen below and behind the tube. Then the ovarian vessels that pass along the suspensory ligament of ovary. Then the uterine vessels that enter through the lower border and which anastomose with the ovarian vessels. Then you have the tubules and duct of epiphron. The tubules are the remnants of the proximal mesonephric tubules and the duct is a remnant of the cephalic part of mesonephric duct. Whereas you also get tubules of parophron and these are remnants of distal mesonephric tubules. And other than that, you have the lymphatics, nerves and sometimes accessory suprarenal tissue. So these are the contents of the broad ligament. This gross image is showing the anterior view of uterus. You can see the body of uterus, the fallopian tube and the ovary. And behind the fallopian tube, you can see the ligament of ovary. And from the ovary to the lateral pelvic wall, you can visualize the infundibulopelvic ligament. You can see the broad ligament of uterus. This is the superior view of uterus. You can see the fundus, the body, and you can also see the fallopian tube. So in front of the fallopian tube, you can see the round ligament of uterus. Behind the fallopian tube, you can see the ligament of ovary and also the ovary. And this is the posterior view of uterus where you are seeing the fallopian tube, the ovary, the ligament of ovary and posterior superior surface of the broad ligament of uterus. The arterial supply of uterus is by two arteries, mainly by uterine artery and partly by ovarian artery. The uterine artery is a branch of anterior division of internal iliac artery, whereas ovarian artery is a branch of abdominal aorta. And you can see here the uterine artery is tortuous and both these arteries anastomose within the broad ligament at the lateral angle of the uterus. The uterine artery crosses above and in front of the ureter at the lateral angle of the uterus. So the cord is water under the bridge. So consider ureter as the water, that means the ureter contains urine, so consider it as a water, whereas the bridge is the uterine artery. So uterine artery is lying above the ureter. And this passes, the uterine artery then passes upwards along the broad ligament and then it anastomoses with the ovarian artery at the lateral angle of the uterus. Now we'll have a look on the branches of the uterine artery. So this is a cross section of the uterus. You can see the uterine artery coming from either side. So identify the internal region, the blue colored region as the endometrium. Then the surrounding region, that is the greenish brown region, that is the myometrium, and outside you can also see the peritoneum, that is a green colored region. Now the uterine artery, you can see it is coming and it is dividing into arcuate artery, and this arcuate artery is also known as coronary artery, and it passes along the anterior surface as well as the posterior surface. You can see the coronary artery or the arcuate artery on either side, and these arteries of both sides anastomose in the midline. So after the formation of the coronary arteries, they divide into radial branches, and these radial branches, you can see, they pierce the myometrium and forms stratum vasculaire. So stratum vasculaire is seen over the middle layer of the muscular cord, that is the myometrium. And from the stratum vasculaire you have two sets of branches, that is the basal branches and the spiral branches. So both these sets of branches pierce the endometrium, or they supply the endometrium, and you can see the basal arteries supply the basal zone of the endometrium, whereas the spiral arteries supply the functional zone of the endometrium. In menstruation, the functional zone is shed off, so the basal zone is remaining there, and it helps in the regeneration of the denuded endometrium. So that is all about the branches of the uterine artery. The venous drainage, the veins correspond to the arteries and drain into the systemic veins via the uterine veins and the ovarian veins. And beneath the peritoneum of the rectouterine pouch, you have a portocaval anastomosis between the uterine veins and the superior rectal veins. Now the nerve supply, it is the uterus is supplied by both sympathetic and parasympathetic nerves via ovarian and uterovaginal plexus. Now the efferent sympathetic fibers arise from T12 to L1 segments of spinal cord, and the efferent parasympathetic fibers arise from S2 to S4 segments of spinal cord. Now the pain sensation from the cervix during the childbirth passes through the parasympathetic nerves, that is the pelvic splanchnic nerves, to the second to the fourth sacral segments, that is to the S2 to S4. And the pain sensation from uterus is carried via the sympathetic lumbar splanchnic nerves. So now we'll see the lymphatic drainage of uterus. So the lymph vessels of the uterus are forming three plexus, that is the subserous plexus, intermuscular plexus and submucous plexus. So the lymph vessels arising from the subserous plexus we'll see now. So try to identify the shown regions, that is the red colored region. You can see here the abdominal aorta, the division is the common iliac artery, that is again divided into internal iliac and the external iliac artery. You can divide the uterus, the whole uterus, into three parts, that is the fundus and upper part of the body as the first part, then the lower part of the body as the second part, and cervix as the third part. Now we'll see the lymphatic drainage. So from the fundus and the upper part of the body, the lymph vessels, most of the lymph vessels drain into the pre-aortic and para-aortic lymph nodes, and these are traveling along the ovarian vessels. And from the lateral angle of the uterus, you can see some vessels also drain into superficial inguinal lymph nodes, and that pass through the round ligament of the uterus. So next is from the lower part of the body. So you can see here in this diagram, from the lower part, the lymph vessels drain into the external iliac lymph nodes. Now from the cervix, these are draining into the external iliac lymph nodes as well as obturator lymph nodes. And some lymph vessels are intercepted by another group of lymph nodes known as paracervical lymph nodes. And also posteriorly, you can see some lymphatics pass along the uterosacral ligaments to the sacral lymph node. And also posterolaterally, the lymphatics can pass along the lateral pelvic wall to the internal iliac lymph nodes. So you can see from the cervix, the lymph nodes drain into the external iliac lymph nodes, obturator lymph nodes, internal iliac lymph nodes, paracervical lymph nodes, and sacral lymph nodes. Another important feature that you have to know about uterus is supports of uterus. Why do you need support for uterus? So that is needed for the prevention of downward displacement of the uterus through the vagina, which is also known as prolapse of uterus. And if the prolapse is associated with the descent of bladder, that is known as cystocele, and if the rectum also participates in the descent, that is known as rectocele. Now, many anatomical and functional components form the primary supports, whereas you also have got some secondary supports. Now, the primary supports are muscular, visceral, and
ligamentous supports. Now we'll see each one by one.
The muscular supports include the pelvic diaphragm, the perineal body and the urogenital diaphragm. The UTERINE muscle of the pelvic diaphragm, it shoulders the maximum brunt in the case of the support of uterus. Now the green colored region that is marked here is the perineal body, which is a fibromuscular node that is seen between the vaginal and the anal orifices. Now the pubovaginal part of the levator ana converged towards this perineal body and it narrows the hiatus urogenitalis. The hiatus urogenitalis is the region through which the urethra and vagina traverse. And therefore what will happen? It will constrict the vagina from the sides and prevents the tendency of the descent of uterus. Now the puborectal sling, you can see in this diagram, it is U-shaped sling and it maintains a forward curvature of the anorectal flexure and upon this the posterior wall of the vagina rests. Now the perineal body is also known as the gynecological perineum because I said already it is seen between the vaginal and the anal orifices and it receives the attachment of various perineal muscles including the levator ani, and thus it maintains the integrity of the pelvic floor. So if it is damaged or if it is torn during childbirth, it has to be properly repaired, otherwise the urogenital hiatus, that is the hiatus through which the urethra and the vagina traverse, both this hiatus will become enlarged and the vagina dilates and the uterus will descend. So the perineal body has to be taken care and properly guarded during the vaginal delivery. The visceral support is nothing but the slanting posterior wall of the vagina. We already saw that the posterior wall of vagina rests on the anorectal flexure, and because of this slanting posterior wall, it receives the load of uterus in the antevated position. Now next is the anorectal flexure, and that also supports the obliquity or the slanting feature of the posterior vaginal wall. Now the upper surface of the urinary bladder acts as a platform upon which the body of antevater uterus can rest. So these factors form the visceral supports of uterus. The ligamentous support is formed by the true ligaments that we have already mentioned. Among that, the round ligament and the uterosacral ligaments maintain the anteversion and anteflexion of the uterus. Now the McEnroe's ligament or the transverse cervical ligament or the cardinal ligament retains the cervix in the median position and prevents the descent of uterus. And I have already mentioned that the tightening of the McEnroe's ligament is an important factor in the surgical repair of the prolapse of uterus. And there are also some secondary supports that are found by the broad ligaments, the uterovesical fold of peritoneum, that is between the uterus and the bladder, and the rectovaginal fold of peritoneum between the posterior wall of the vagina and the rectum, and loose packing material, which is also known as parametric tissue, which spreads between the pelvic fascia and endopelvic fascia. So this loose packing material fills up the dead spaces between the pelvic peritoneum and the pelvic floor. And around the cervix, these tissues are thickened to form radiating fibromuscular bands. So they restrict the movement of the cervix, whereas the parametrium makes the uterine body mobile. So these are some of the secondary supports of uterus. I hope you are clear with the gross anatomy of uterus. We'll come up with the applied aspects and the gross anatomy of other reproductive organs in the coming sessions. Thank you.